टॉपिक है ग्रोथ हार्मोन का। IGF-1 is also known as somatomedin C. It is more active than IGF-2 and seems to be directly related to growth. It acts through the receptor similar to insulin receptor and is linked to intracellular tyrosine kinase activity. Effect on protein metabolism. GH promote protein synthesis and cell proliferation on both skeleton and non-skeleton tissues. It increases cellular uptake of the amino acids and stimulates transcription. Overall, in its growth promoting effects are insulin like and tend to turn the nitrogen equilibrium toward positive nitrogen balance. Third, effect on carbohydrate metabolism. Effect of GH on the lipid and carbohydrate metabolism are opposite to those of insulin. GH promotes glycogenesis and gluconeogenesis in the liver and decreases utilization of glucose in muscles and other tissues. These actions result in increase of blood glucose level. Hence, GH is a diabetogenic hormone. Effect on lipid metabolism. GH promotes lipolysis in adipose tissues to elevate the circulating free fatty acid level. Oxidation of fatty acid in liver is decreased and ketogenesis is enhanced. Effect on mineral metabolism. Growth hormone promotes bone mineralization and its hormones as clearly observed in the growing children. Effect on lactation. GH has structural similarity with prolactin, which account for its prolactin-like effect of increasing milk production in lactating animals. Other effects. GH stimulates cellular differentiation and augments action of other tropic hormones. Regulation of the growth hormone. GH is controlled by the dual system, namely growth hormone releasing hormone and the growth hormone release inhibiting hormone, which respectively increases and decreases the release of GH. GH secretion is greatly enhanced during sleep when the plasma GH concentration may reach up to 100-fold greater than the baseline. IGF-1 also causes inhibition of GH by the dual mechanism. Alpha, it inhibits GHRH secretion, and beta, it stimulates somatostatin secretion. Clinical disorder of GH secretion. GH deficiency in children results in short stature dwarfism, while GH excess in children leads to gigantism. In adults, since the epiphyses of the long bones have closed linear growth is not possible. Therefore, the adult's form of GH excess called acromegaly manifests by thickening of tissues and a change of facial appearance, excessive hair, thickening of skin, etc. GH excess is almost always due to GH secreting pituitary adenoma. Prolactin chemistry, it is a polypeptide of 199 amino acids whose amino acid composition is similar to that of GH. Regulation of prolactin secretion. Secretion of the prolactin from the anterior pituitary is increased by the hypothalamic hormone prolactin release factor. Prolactin release inhibiting factor such as dopamine inhibits prolactin secretion. Biochemical function of prolactin. In association with the other pregnancy related hormones, prolactin assists initiation and maintenance of lactation and promotes full development of the breast tissues. It binds to its receptor in mammary tissues and stimulates the synthesis of several milk proteins, including lactalbumin. Thyroid stimulating hormone is synthesized in the pituitary thyrotrophs and act on the thyroid glands to increase synthesis and secretion of the thyroid hormone. It is also called thyrotrophic hormone or thyrotropin. Chemistry. TSH is a dimer glycoprotein with a molecular weight of about 30,000 TSH, FSH, and LH. are the glycoprotein hormones of pituitary. All the three are made up of two subunits. Alpha subunit is a common to all the three, while the beta subunit is specific for each of them. Regulation TSH. The release factor for TSH is the hypothalamic TRH. Circulating thyroid hormone inhibits secretion of TSH by feedback mechanism.